The Global Surgery Lab presents a lower limb fasciotomy posteromedial incision crash course. This procedure releases pressure in the superficial and deep compartments of the leg and must be paired with the anterior lateral incision when compartment syndrome is suspected. The basic steps include landmarking, creating a skin flap, opening the superficial compartment, and opening the deep compartment. You will need a knife and curved scissors. To landmark, find the medial malleolus, the medial condyle, and crest of the tibia. From the crest of the tibia at mid-shin, palpate posteriorly to identify the posterior border of the tibia. Remember that the tibia is triangular in cross-section. Your incision should be made 1 thumb posterior to the posterior aspect of the tibia in line with the medial malleolus and medial condyle. To create the skin flap, make 1 long incision through the skin parallel and 1 thumb posterior to the posterior aspect of the tibia using your knife. The incision should be 12 to 20 centimeters in length, extending from 3 fingers distal to the medial condyle of the tibia to 3 fingers proximal to the medial malleolus. Be careful not to damage the greater saphenous vein or nerve, and make sure you ligate any perforated branches of the saphenous vein, as these can be very superficial and bleed profusely. In this video, our skin incision was too short. Make sure to cut through the full length of your punctuated line. Mobilize the skin to reveal the underlying fascia. To open the superficial compartment, cut through the fascia 1 thumb posterior to the posterior border of the tibia using partially opened scissors. Open the fascia from just distal to the medial tibiocondyle to just proximal to the medial malleolus so that you can clearly identify the soleus muscle, a key step towards locating the deep compartment. To access the deep compartment, mobilize the fibers of the soleus muscle to separate these muscle fibers from the posterior aspect of the tibia. Separating the soleus from the posterior aspect of the tibia will reveal the fascia covering the deep compartment. Cut through the fascia into the deep compartment by sliding your partially opened scissors along the fascia you've uncovered over the length of your skin incision. Note that the deep compartment can sometimes be confused for the pocket between the soleus and gastrocnemius muscle. Identification and visualization of the posterior tibial neurovascular bundle will confirm entry into the deep leg compartment. Make sure all leg compartments are open along the full length of your long skin incision to prevent the skin or fascia from acting as a constrictor band. After the procedure is complete, do not close the wounds primarily. Leave them open for a minimum of 48 hours. Cover with sterile wet-to-dry dressings that are changed regularly and consider a shoelace closure.